Have you ever finished a perfectly normal meal only to feel as though your stomach had suddenly doubled in size? Your clothes feel tighter, you keep burping, and by evening your abdomen feels so full that even sitting comfortably becomes difficult. Some people tell me they avoid going out after dinner because they feel embarrassed by how swollen they look. If you have experienced this, you are certainly not alone. As a gastroenterologist, I hear this complaint almost every day. Patients often walk into my clinic and say, "Doctor, I don't even eat that much, so why do I feel as though my stomach is ready to burst?" Many of them have already tried antacids, herbal remedies, digestive tablets, or home treatments recommended by friends and relatives. Some feel better for a short time, but the discomfort always seems to come back. The biggest surprise is that most of these people are treating the wrong problem. Many believe bloating simply means there is too much gas inside the stomach. That sounds logical, but it is not always true. I have seen patients with very little intestinal gas who feel extremely bloated, while others produce much more gas during normal digestion and hardly notice any discomfort. This is why taking medicine for gas does not always solve the problem. Unless you understand what is actually causing your symptoms, you may continue struggling for months or even years. In today's video, I will explain the real reasons why bloating becomes so common, especially after the age of 60. We will uncover the everyday habits that quietly make your digestive system work harder than it should, the hidden medical conditions that should never be ignored, and the simple, science-based steps that can help you feel lighter after meals. I encourage you to stay with me until the very end because the final cause I will discuss is one that many people completely overlook, yet recognizing it early can make a remarkable difference to your digestive health. Before we begin, I have a small request. If you often experience bloating after meals, or if someone in your family struggles with the same problem, type the number 1 in the comments below. I enjoy reading your experiences, and your comment may reassure someone else that they are not facing this problem alone. Now, let us start with an important question. What exactly is bloating? Bloating is not a disease. It is a symptom that usually feels like fullness, tightness, pressure, or swelling inside the abdomen. Some people describe it as feeling as though there is a balloon expanding inside their stomach. Others simply say they feel heavy and uncomfortable even after eating a modest meal. As doctors, we also distinguish between bloating and abdominal distension. Bloating refers to the uncomfortable sensation of pressure or fullness, even when your abdomen looks completely normal. Abdominal distension is different. In this case, the abdomen actually becomes larger, and the swelling may even be visible to other people. This difference is more important than it may seem because it gives us valuable clues about what is happening inside your digestive system. And here is something that surprises many of my patients. One of the most common causes has very little to do with the food itself. Instead, it is a simple eating habit that millions of people repeat every single day without realizing the harm it can cause. Let us begin with that mistake first. That simple habit is eating too quickly. It may not sound like a serious mistake, but after treating digestive disorders for many years, I can tell you that this is one of the most common reasons people experience discomfort after meals. In fact, I have seen many patients improve significantly without changing what they eat. They simply changed how they ate. Think about your own routine. Breakfast is often finished in a rush because there is work to do. Lunch may be eaten while watching television, answering phone calls, or scrolling through your mobile phone. Dinner is sometimes the only meal when the whole family sits together, yet everyone still seems to finish within 10 minutes. Your digestive system was never designed to work that way. The first problem is that you swallow much more air than you realize. Every hurried bite carries small amounts of air into your stomach. Over the course of an entire meal, that extra air builds up, leading to frequent burping, pressure, and an uncomfortable feeling that many people mistake for excessive gas. The second problem begins before food even reaches your stomach. Digestion actually starts in your mouth. Every time you chew, your teeth break food into smaller pieces while your saliva begins the first stage of digestion. When food is swallowed after only a few quick bites, Your stomach has to work much harder to process larger pieces of food. Although this does not necessarily mean food stays in the stomach for an unusually long time, it often makes digestion feel slower and less comfortable. Many people notice a heavy, overly full sensation simply because they rush through their meal. There is another reason this habit causes trouble. Your stomach and your brain are constantly communicating. After you begin eating, it takes roughly 20 minutes for your brain to receive the message that you have had enough. If you finish your meal in 7 or 8 minutes, you can easily eat far more than your body actually needs before those signals arrive. An overfilled stomach stretches more than it should, creating pressure that leaves you feeling sluggish, uncomfortable, and overly full for hours. Just a few days ago, a six-year-old gentleman visited my clinic convinced that he had developed a serious digestive disease because he felt bloated after almost every meal. As we discussed his daily routine, one detail stood out immediately. He finished lunch in less than 8 minutes every single day. I asked him to change only one habit: slow down, chew properly, and allow at least 20 minutes for each meal. 2 weeks later, he returned smiling. His discomfort had improved dramatically without adding a single new medicine. This is why I always remind my patients that the simplest solutions are sometimes the most effective. So, what should you do? Eat without rushing. Put your spoon or fork down occasionally between bites. Chew each mouthful thoroughly before swallowing. Try to avoid eating while watching television or constantly looking at your phone, because distractions often make you eat faster than you realize. Most importantly, give yourself enough time to enjoy your meal instead of treating it like another task to finish quickly. If you are finding these practical tips useful, I invite you to subscribe to the channel. Every week, I share simple science-based advice to help you protect your digestive health, avoid common mistakes, and stay healthier as you grow older. But eating speed is only one part of the story. There is another reason why some people feel uncomfortable after eating foods that others digest without any difficulty. The answer lies inside your intestines, where trillions of beneficial bacteria work quietly every single day. These tiny organisms, known collectively as the gut microbiome, play an essential role in digestion. They help break down certain foods, support your immune system, and even produce important nutrients for your body. As they digest carbohydrates that reach the large intestine, they naturally produce gases such as hydrogen, methane, and carbon dioxide. This is a completely normal process and happens in every healthy person. However, some carbohydrates are more difficult for the small intestine to absorb. These travel further into the colon, where bacteria ferment them more actively, producing larger amounts of gas. This group of carbohydrates is known as FODMAPs. Foods such as onions, garlic, chickpeas, rajma, beans, certain fruits like mangoes and watermelon, some artificial sweeteners, and even wheat products can trigger symptoms in sensitive individuals. The important point is this: these foods are not unhealthy. In fact, many are packed with fiber, vitamins, and minerals. The difference is that every digestive system is unique. A food that causes discomfort in one person may cause no symptoms at all in someone else. Rather than avoiding dozens of healthy foods, the smarter approach is to identify your own trigger foods. Once you recognize them, you can often reduce digestive discomfort while continuing to enjoy a balanced and nutritious diet. But even if you eat slowly and avoid your trigger foods, there is another hidden problem that can keep your abdomen feeling heavy day after day. That problem is constipation. Many people immediately tell me, "Doctor, I cannot possibly be constipated because I pass stool every morning." Unfortunately, that is one of the biggest misconceptions I hear in my clinic. Having a bowel movement every day does not automatically mean your bowels are healthy. Constipation is also about how well your bowels empty. Let me ask you a few simple questions. Are your stools usually hard or dry? Do you need to strain? Do you spend several minutes sitting on the toilet without feeling completely relieved? Do you often leave the bathroom with the feeling that something is still left behind? If you answered yes to any of these questions, constipation could be contributing to your digestive discomfort, even if you have a bowel movement every day. When stool remains inside the large intestine for longer than normal, your gut bacteria continue breaking it down. As this fermentation continues, more gas is produced, the intestine gradually stretches, creating pressure, fullness, and that uncomfortable swollen feeling many people experience by the end of the day. I have seen patients spend months searching for the perfect diet when the real problem was simply untreated constipation. Once they improved their bowel habits, the bloating that had troubled them for years became much less frequent. Sometimes the answer is far simpler than people expect, but constipation is still not the whole story. There is another reason why some people notice every tiny movement inside their digestive system, while others hardly notice anything at all. The answer lies in the remarkable connection between your brain and your gut. Your digestive system contains millions of nerve cells that communicate continuously with your brain. Scientists often refer to this as the brain-gut axis. It is one of the most fascinating communication systems in the human body. When you are under constant stress, sleeping poorly, feeling anxious, or carrying emotional pressure for weeks or months, those signals begin to change. Your intestines may move differently, and more importantly, they can become far more sensitive than normal. Imagine two people sitting at the same table eating exactly the same meal. Their digestive systems may produce almost the same amount of gas, yet one person feels perfectly comfortable while the other develops pressure, cramping, and a swollen abdomen. The difference is often not the amount of gas. It is how sensitive the digestive system has become. This is something we see very often in people living with irritable bowel syndrome, commonly known as IBS. In IBS, the intestine reacts much more strongly to normal digestion. Even ordinary stretching after a meal or the usual amount of gas produced by healthy bacteria can feel surprisingly uncomfortable. That is why managing stress is not just good for your mind, it is also an important part of caring for your digestive health. Good sleep, regular physical activity, relaxation techniques, and taking time to slow down each day can all help reduce digestive symptoms in many people. Before I explain the final cause, I would like to ask you something. If you often experience bloating, constipation, or discomfort after meals, please write the word digestion in the comments below. I read your comments carefully, and they help me understand which digestive health topics you would like me to discuss in future videos. Now let us talk about the one situation that should never be ignored. Although bloating is usually related to eating habits or common digestive problems, persistent symptoms can sometimes point to an underlying medical condition that requires proper evaluation. Some people have lactose intolerance, meaning they cannot digest the natural sugar found in milk and dairy products. Others develop small intestinal bacterial overgrowth, or SIBO, where excessive bacteria grow in the small intestine and produce unusually large amounts of gas. There is also celiac disease, an immune condition in which gluten damages the lining of the small intestine, making it difficult to absorb nutrients properly. In some individuals, the stomach empties more slowly than normal, causing food to remain there longer and leading to prolonged fullness after meals. Women may occasionally experience persistent abdominal swelling because of large ovarian cysts. Liver disease can cause fluid to accumulate inside the abdomen. In rare cases, persistent bloating may even be an early symptom of gastrointestinal cancer. Please do not panic when you hear this. Most people with bloating do not have cancer. However, if your symptoms continue for several weeks, become progressively worse, or are accompanied by unexplained weight loss, persistent vomiting, blood in the stool, severe abdominal pain, difficulty swallowing, or a noticeable loss of appetite, do not keep guessing or relying on home remedies. See a gastroenterologist. Identifying the real cause early often leads to simpler treatment, better results, and much greater peace of mind. The good news is that, for most people, improving bloating does not require expensive supplements or complicated treatment plans. In many cases, the biggest improvements come from changing a few everyday habits. These changes may seem simple, but when practiced consistently, they can transform the way your digestive system feels. The first habit is to slow down every meal. We have already discussed why eating too quickly causes you to swallow more air and makes it easier to overeat. But slowing down does something even more important. It allows your digestive system to work at its natural pace. Sit down comfortably, avoid rushing, chew each mouthful thoroughly, and give yourself about 20 minutes to finish your meal. Instead of treating food as another task to complete, think of each meal as an opportunity to support your health. Your stomach will thank you for it. The second habit is one that I recommend to almost every patient who complains of feeling heavy after eating. Take a gentle walk for 15 to 20 minutes after your meal. You do not need to walk fast, and you certainly do not need to exercise intensely immediately after eating. A relaxed walk is enough. Gentle movement helps stimulate the normal contractions of your digestive tract, allowing food to move forward more smoothly while helping gas pass naturally through the intestines. Many patients tell me they notice less fullness, fewer episodes of burping, and a lighter feeling simply by making this one habit part of their daily routine. The third habit is to identify your personal trigger foods instead of eliminating everything from your diet. This is where many people make a costly mistake. After reading advice online, they stop eating fruit, dairy products, lentils, wheat, vegetables, or other nutritious foods all at once. Unfortunately, this often creates unnecessary dietary restrictions without solving the real problem. Every digestive system is different. A food that causes discomfort for one person may be perfectly well tolerated by someone else. That is why I encourage my patients to keep a simple food diary for 2 or 3 weeks. Record what you eat, when you eat it, and whether symptoms appear afterwards. Very often, clear patterns begin to emerge. You may discover that only 1 or 2 foods consistently trigger your symptoms, allowing you to continue enjoying a balanced and nutritious diet without unnecessary sacrifices. The fourth habit is to maintain healthy bowel movements. If constipation is contributing to your symptoms, improving your bowel habits can make a remarkable difference. Drink enough water unless your doctor has advised you to limit fluids. Eat adequate fiber from vegetables, fruits, legumes, and whole grains if your digestive system tolerates them well. Stay physically active every day and never ignore the natural urge to pass stool. Small daily habits like these support healthy bowel function and reduce the chances of excessive fermentation inside the large intestine. Finally, I want to address something that has become extremely popular on social media. Many advertisements claim that detox drinks, colon cleanses, herbal powders, or cleansing kits can remove toxins and eliminate bloating within days. These promises sound attractive, especially when you have been struggling with digestive discomfort for a long time. However, the scientific evidence tells a different story. There is no convincing evidence that routine colon cleanses improve everyday bloating in healthy individuals. In some cases, these products may even cause dehydration, disturb the balance of beneficial gut bacteria, or irritate the intestines. Your body already has highly efficient organs, including the liver, kidneys, and digestive tract that naturally remove waste every single day. What they need is not miracle products, but healthy, consistent habits that support normal digestion. One thing I have learned after many years in clinical practice is this. Patients who focus on simple daily routines almost always achieve better long-term results than those who constantly search for quick fixes. If these practical tips have helped you understand your digestive system a little better, please take a moment to give this video a like. Your support allows YouTube to recommend this information to more people who may be silently struggling with the same problem. A single click from you could help someone finally discover the real reason behind their symptoms. But before we finish, there is one final message I want every viewer to remember. Knowing when bloating is harmless and when it could be a warning sign is just as important as knowing how to prevent it. Let us end with the advice I give every patient before they leave my clinic. Before we end today's discussion, I want you to remember one message above all else. Bloating is a symptom. It is not a disease by itself. Your body is trying to tell you that something in your digestive system needs attention. For many people, the cause is surprisingly simple. It may be eating too quickly, overeating, constipation, stress, or sensitivity to certain foods. Once the real cause is identified, the solution is often much easier than people imagine. At the same time, persistent bloating should never be dismissed as just gas. If your abdomen feels swollen almost every day for several weeks, if your symptoms are becoming more frequent or more severe, or if they are accompanied by warning signs such as unexplained weight loss, persistent vomiting, blood in the stool, severe abdominal pain, difficulty swallowing, persistent loss of appetite, or extreme fatigue, you should arrange a medical evaluation as soon as possible. These symptoms do not automatically mean you have a serious illness, but they should never be ignored. Identifying the underlying cause early gives you the best opportunity for effective treatment and peace of mind. One mistake I see far too often is people trying one remedy after another without ever discovering what is actually causing their symptoms. They buy digestive tonics, herbal mixtures, detox powders, and over-the-counter medicines, hoping that one of them will finally solve the problem. Sometimes they experience temporary relief, but the discomfort soon returns because the real cause has never been addressed. If your bloating continues despite making healthy lifestyle changes, do not keep guessing. A consultation with a gastroenterologist, along with the appropriate investigations when necessary, can often identify the cause much faster than months of trial and error. The encouraging news is that most people do not need complicated treatment. In many cases, improving everyday habits can make a remarkable difference. Eat slowly, chew your food well, avoid overeating. Stay physically active, especially after meals. Keep your bowels regular. Learn which foods your body tolerates well, and do not eliminate nutritious foods unless there is a genuine medical reason to do so. These simple habits may not sound dramatic, but they are supported by science and have helped countless patients regain comfort and confidence in their daily lives. After many years of caring for people with digestive disorders, I have learned one important lesson. Your digestive system is incredibly resilient. It responds to the choices you make every single day. Small, consistent improvements are often far more powerful than dramatic changes that last only a few days. Be patient with your body, stay consistent with healthy habits, and give your digestive system the time it needs to recover. I also want you to remember that every person's digestive system is unique. What works perfectly for one individual may not be the right solution for another. That is why understanding your own symptoms, recognizing your personal triggers, and seeking professional advice when needed are so important. The goal is not simply to reduce bloating for a day or two. The goal is to build long-term digestive health that allows you to enjoy your meals and your life without constant discomfort. If you found this video helpful, please share it with your family, your friends, or anyone who often complains of bloating after meals. A simple share could help someone recognize an important warning sign, understand the real cause of their symptoms, and seek the right treatment before the problem becomes more serious. Thank you for spending your time with me today. I truly appreciate your trust and your willingness to learn more about your health. I hope the information you learned today helps you feel more confident about understanding your digestive system and making healthier choices every day. Until we meet again in the next video, take good care of yourself, stay active, eat mindfully, and give your digestive system the care it deserves.